Alright, I'm gonna do a video on methadone, and a couple people have been asking me the side effects of methadone. I've been on and off of the program for 25 years. I've been off the program now for about 6 months, and I will never get back on it again. Now, the biggest thing is methadone has a lot of physical side effects. Yeah, they're short-term, 30-day side effects. But the biggest thing about methadone is the mental long-term side effects. The thing is, these people in methadone programs, they trick you. They say, okay, this is prescribed by a doctor. It's called MAT, medication addiction. Medication assisted treatment, MAT is what they call it now. This is the big thing that's fishing everybody in, so you give them your insurance information so they can get paid. I mean, methadone is a bigger payer than friggin' cancer medication, because methadone, it can keep you on it forever. I mean, cancer you at least get rid of after a couple of years, but methadone, people stay on it for 10 and 20 and 30 years at a time. And it totally changes their whole entire thought process on anything. I mean, like, you got some people to get on a methadone program to say, yeah, I want to get a free high. I want to get a free high so I can be high, and them type of people, they already have their thought process. But when you're a person that wants to get off of drugs and you go, they make it seem like it's okay to be on methadone. Like, this is okay. It's prescribed by a doctor. And then you have this thought that, it's a necessity. Like, every day you have to get up, you have to go get your medication, you have to go get your methadone before you do anything. You have this thing in your brain that'll make you feel sick if you don't go get it, and you feel like it's okay to do because it's under a doctor's care. Now, when we're born, we have morals, principles, values, and you might value the fact that you never leave your kid by himself, or never would put your child in harm. But I've seen people with these same values that will wake up in the morning and say, you know what, I gotta go to the program, and the only way I can go is to get this ride right here. I'm gonna leave little Bobby sleeping, and I'm gonna come right back. And this is a value or a moral or principle that you would not do unless you were on if you were not getting high. Now, there's millions of things. This changes your whole thought process, the whole way you think about anything. I've had a bunch of different girls that I've been with saying, well, the doctor's giving it to me. It's okay. The doctor gives me Xanax. That means it's okay. It's okay. No, it's not okay at all. When you're born, you don't need these things in your body, and you don't need them now. And since I've been off of it, I've been seeing it so much clearly now, it's just ridiculous. That somebody on methadone, that they have you trapped on a methadone program for your whole entire life, damn near. These people wake up in the morning, and that is their first priority. Nothing else comes first but getting to that program. I don't care how long the line is. I don't care how many people are there waiting. I don't care what's going on. They're going to go get this methadone because it's got them brainwashed. Their whole mentality will change. Now, as far as bills to pay, that methadone program is going to be the first thing you pay for. You won't pay your rent. You won't pay nothing. So how can, these clinics actually say that they're doing the right thing by giving you something that makes you twice or 3 times as sick as fentanyl or heroin, and keeps you sick longer for heroin? When you go, I want anybody that's on the methadone program to do this right now. It's a test. You go into the methadone program tomorrow, and you tell your counselor that you want to go down in dose 10 milligrams. Now, see how long it takes them to take your dose down, okay? And see how long it takes. And then somebody else or you go back in there one day and say, hey, look, man, I think I'm going to relapse. I want my dose to go up. Now, I guarantee they're going to take your dose up day or two. You see the doctor, wham, you're up to 100 milligrams immediately. You ask them if you want to go down, you got to sign papers, you got to talk to the doctor, you can't do it, blah, blah, blah. And if you ask them, say, hey, look, I don't want that much, just give me 50. They'll say, no, you can't have any of your dose unless you take your whole dose. And these are people that are supposed to be helping us and getting us off of, substances and trying to make us productive members of society again. Now, I just find that absolutely ridiculous. I find it absolutely ridiculous and preposterous that these people say they're trying to help addicts when they do this. Now, it's just crazy. I mean, and then you have, methadone. It heeds your travel. You can't go anywhere. You can't go to California because you need your bottles. If you got to go to California, I went to Florida one time years ago. I had to find a program in Florida, and I had to go pay $12 a day to get medicated. I had to get up every day in Florida. I mean, it changes everything about your life. If you got to go to work, you got to tell your boss, hey man, you will be late to work every single morning. Even if you're one of them people that used to be on work 15 minutes early, this methadone program will make you be 10 minutes late. You will tell your boss, well, my treatment is worth more than this bullshit job, blah, 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 blah. And think about what you're saying. You're taking a moral that you had and you're putting it to the side. And then if you really think about it, do you believe inside that it's okay to be late for work because I need to go get methadone? No, you don't believe that it's okay. You got to go into your beliefs, because what you believe, core beliefs, never change. They never change. They stay the same your entire life. When you're using drugs, do you actually believe it is okay to stay in an abandoned house and not take a shower and not brush your teeth and not wash your ass? Do you believe it's okay to eat out of a dumpster? No, you don't believe these things. But morally, you will, and as far as your value to it, as far as the principle is concerned, you will throw values, morals, principles all in the trash can for either drugs or methadone. Now, the only difference is between methadone and street drugs is the government gives it to you, and you think it's a brainwash tactic. You think you're doing something special because you're going to this methadone program every day, and it's MAT. They make it a neat name, medication assisted treatment. Yeah, medication assisted treatment. They're starting to give methadone out in prison. Now, think about that. Prison, the only people that can distribute methadone in prison is somewhere the government has their hands in it. Now, just recently, Towson Detention Center in Baltimore, they're starting to give out methadone. City Jail has been doing methadone forever. They will bring a kid that's 18 years old into City Jail, and all he has to do is say the words, I am on heroin, I need treatment. They will not, piss him. They don't piss you and see if you have drugs in your system. They just give you 30 milligrams of methadone.